We are doing our presentation on Jehovah Witness. This is by Sage, Kaylee, and Kelsey. And starting with the beliefs and values of Jehovah Witnesses. Jehovah Witnesses believe that God, Jehovah, is a singular being separate from Jesus and the Holy Spirit. They do not celebrate birthdays or holidays because they view holidays as distractions from spiritual goals and faith. And then a quote from Wikimedia: they do not observe Christmas, Easter, birthdays, or other holidays and customs they consider to have pagan origins incompatible with Christianity. They avoid blood transfusions due to Bible principles. They believe that marriage should be between a man and woman only. They avoid social, ethnic, racial, or class divisions. Some may participate in organ donations, but it is a personal choice.
So, expectations of healthcare. Jehovah Witness accept medicine and medical treatment, but it depends on the individual and the personal choice on what they decide to accept, a particular medicine or treatment. They are willing to receive organs if necessary based on the person's willingness to accept the medical treatment. A quote that I found in jehovahwitness.org is, it says, "Some treatments conflict with Bible principles, though, and we reject these. For example, we don't accept blood transfusions because the Bible forbids taking in blood to sustain the body. There are many instances that Jehovah Witness do need a doctor and are willing to accept medical treatment."
So differences from typical local practices in healthcare in Utah. With Jehovah Witnesses, they tend to revolve around the use of blood products, which include whole blood, red blood cells, white blood cells, platelets, and plasma, so they won't receive any of these.
Individualized healthcare techniques. Having other products other than blood. This is maximizing oxygen delivery, erythropoietin stimulating agents, and iron supplements. Respecting their wishes and non-judgmental conversations, and documenting the patient's refusal. Making sure that the patient isn't pressured into accepting blood products during medical procedures to make known to the doctor and the anesthesiologist so that they are prepared to manage without blood products.
So, multiple choice questions. Our first one is, which type of blood products are Jehovah Witness taught to refuse? White cell products, whole blood products, plasma, or all the above? Answer is all of the above. Number 4, and the rationale is Jehovah Witnesses are taught to avoid all blood products, whole blood, white and red cell products, plasma, and platelets.
Number 2, if a Jehovah Witness was mentally competent and they refused a life-saving transfusion, what would you do as the nurse? Number 1, respect their wishes. Number 2, try to convince them to receive the transfusion. Number 3, give the blood anyway. Or number 4, contact the provider. And then the answer for number 2 is 1, respect their wishes. Jehovah Witnesses do not participate in blood transfusions as part of their religion.
Question number 3, a Jehovah Witness is scheduled for a kidney transplant. How would the nurse intervene? Number 1, contact the surgeon into having the procedure postponed. Number 2, speak with the charge nurse and complete an incident report. Number 3, continue with the surgery with the planned adjustments. Number 4, prepare blood products to be administered post-procedure. And the answer for number 3 is number 3, continue with the surgery as planned. And the rationale for that is, while Jehovah Witnesses decline blood products, they do believe that organ donations are based on personal preferences.
So, question number 4, the nurse is caring for a 30-year-old patient with a hemoglobin level of 7.4. The provider initiates orders for a blood transfusion, but the nurse knows the patient is a Jehovah Witness. How should the nurse respond? Select all that apply. Start the blood transfusion, report to the provider to management, maximize oxygen delivery, notify provider, have patient sign a consent form, or gather iron supplements. The answer is maximize oxygen delivery, notify provider, and gather iron supplements. The rationale is when religion interferes with patient care, the provider should be notified and using alternate methods for blood transfusion, such as maximizing oxygen delivery, erythropoietin stimulating agents, and iron supplements should be used.
Number 5, the nurse is caring for a 72-year-old who is a Jehovah Witness and has been recently admitted for pneumonia. During rounds, the nurse notices it is their birthday. How should the nurse respond? Number 1, remain neutral without mentioning it. Number 2, plan a birthday party for them. Number 3, surprise them by ordering a cake for lunch. Or number 4, ignore their request of no celebrations because they are just depressed. The answer would be number 3, remain neutral without mentioning it, and the rationale is Jehovah Witnesses do not celebrate birthdays or holidays because they view holidays as distractions from spiritual goals and faith. And there's our references.